So people that have an unstable shoulder, most commonly the shoulder will be dislocating out the front. Less common, the shoulder would dislocate out the back. And there's two main reasons that your shoulder would dislocate. One would be from a traumatic injury. So you're playing a sport, you fall, and your shoulder dislocates. And when that's the case, you're tearing a structure called the labrum in your shoulder. The labrum is a piece of cartilage, similar consistency to your ear, it's flexible. And the labrum is where the ligaments attach to. So if the attachment to the ligaments is no longer attached to the bone, then the result is your shoulder will continue to dislocate if it's put in the wrong position, I should say. The second reason that people have shoulder instability is generalized ligamentous laxity. That is your anatomy. Those are the genes you were given, and your joints are just loose. And so that's the other reason that their shoulders can become unstable. Whether you have instability from a labral tear or instability from generalized ligamentous laxity, in general there's two different treatment options. So surgical treatment of an unstable shoulder from a labral tear is going to involve repairing the labrum back down to the socket where it's torn from. That's an arthroscopic procedure that's done typically, if it's an anterior labral tear, through two little incisions, one in the front, one in the back. And essentially we're going to put suture around the torn labrum. We're going to attach that suture to what's called a biocomposite implant, and then that'll be repaired back to the socket. If it's shoulder instability from generalized ligamentous laxity, and you have failed conservative treatment, which would typically be tried first in this condition, so that would be physical therapy, that would be activity modification, then we can do a procedure to help tighten up the ligaments in the shoulder.